With regard to the Breast Milk Performance Improvement Program, here's how we approached the planning stage in our institution. In our NICU, we had a problem of an increased rate of necrotizing enterocolitis and late onset sepsis. Why is this important and why is it a priority? We know that very preterm babies are at risk for NEC and late onset sepsis, and we know that they have poor neurodevelopmental outcomes as a result of these infections. Part of this translates into higher healthcare costs because babies who develop NEC or late onset sepsis typically are in the hospital longer, so they have an increased length of stay and increased days on IV nutrition or TPN. That's why we looked at this particular problem in our unit. When we asked the question, who is involved in the problem, we're not trying to place blame on anyone. We're looking to see who are the people, who are our resources that can actually help us with this problem. Who can help us to make an improvement here? And that comes down to the team, which we will get into more detail later on. Let's look at verifying our problem and the root cause. We need data to verify a problem. What is the current data source? In our case, we did a retrospective chart review of all the babies that were admitted to our NICU from 2009 to 2012 to see just exactly how high was our rate of NEC and late onset sepsis. Again, the problem needs to be factual. It wasn't enough just to say, I think we have a high rate of NEC or late onset sepsis. It's not just an educated guess, and it's not just based on someone's opinion. It needs to be based on fact. That's why we went back through our charts to actually quantify our rate of NEC and late onset sepsis. What is the root cause? We had to keep asking why. Why were we having a high rate of NEC? Why was our rate of NEC higher than some other hospitals or NICUs? Was our current practice or our current feeding protocol based on evidence-based practice or EBP? These are some of the things we had looked into. Let's look at how we determine our evidence-based practice. How do we check the evidence? We do it through a review of the literature. We actually did conduct a thorough literature search, and we focused on best practices. The literature review needs to evaluate the strength of research as well as best practices implementation. Were there randomized controlled trials? Were they well designed? Were there meta-analyses and systematic reviews included in your review? Make sure that the research you're reviewing is specific to the problem identified. And can the research be applied to your specific patient population? In our case, there's a tremendous amount of research out there regarding NEC and late onset sepsis that we had to review. It was very specific to our patient population, and it was most helpful. Another question that you have to ask as you're going through the research is how motivated is the department or organization to making changes based on the current research and evidence-based practice. In our situation, because we had such a high rate of NEC and late onset sepsis, we had a very motivated NICU as well as support from administration to make changes that would improve those outcomes. We knew it was very important. Again, you have to look at your particular institution and what problem you've identified, because there may be situations where you may not have that support and you may not be able to make the changes that you feel you need to make in order to improve your outcome. What are the barriers to the change? It can be increased cost. Maybe you need more FTEs to make these changes. Maybe you need more equipment. Maybe you need to actually renovate a space. Again, these are all things that can be a barrier to making a change, even if it's based on good research. Those are just some things to consider when you're actually doing your review.